Good morning, guys. Welcome to the day in the life of a 24-year-old studying medicine in Brazil and working at the hospital as an intern. So I woke up at 6:30. I woke up a little bit late. I'm supposed to enter at 7, but I can enter later when my preceptor enters late during that day. For example, today, she's only gonna go through the cases with us in the afternoon. So, I'm kind of early, honestly. Let's hit the shower. I like to put my shower very hot. I'm done with the shower. So this is my school pajama. I'm not gonna do any skincare today, although, because I'm late, but I'm gonna show you some of the products I have been using. We have the ordinary niacinamide 10% plus zinc 1%. We have Principia, which is the mandelic acid plus arbutin. Always gets me. Arbutin acid 1% and mandelic acid is 10%. And then I've been using Medicube. This is a South Korean skincare brand. It's really nice, and I've been using their masks as well, and the facial serums. Okay, so I'm gonna do a little bit small to eat, something small, and then we're gonna get ready to leave for work. Doing my eggito. So I'm doing 30% integral bread with 4 eggs. That's what I'm having for breakfast today.
E aí, tava lotado o cinema?
Tava. Lotado, mas foi muito bom o filme.
Imagino que é a volta, né? E reformaram?
So I arrived at the hospital and I'm waiting for the elevator to turn on so that I can go all the way up to the second floor. I don't want to do the stairs today. Get in the morning, I gotta go and look at patients in their beds, and then I look at the system, I key in the information, and their vital signs. That's the first thing in the morning. This patient has hepatitis, which is causing him to have a lot of liquid in his abdomen. He has cirrhosis, but the alcohol one. He ingested alcohol for a lot of years, and he has renal failure. Well, not complete, but he does have renal failure. His kidneys are not functioning very well. So this has been happening to him for the past years, and he has been inside and outside the hospital for some time. But he's a very enthusiastic man, and honestly, he's very inspirational. He also has diabetes. So I'm not going to show in this video, but he removed his fast thumb, not thumb, but like the big toe finger, the big toe. He removed it because of the diabetes, but he's so enthusiastic, so happy. He wanted to go home and dance. He's a really nice patient. So all these instruments are cleaned thoroughly, and we have to use sterile gloves to do every procedure. This was my second time doing it. I have done it before, but my professor helped me the first time. So this is me doing it alone for the first time. You have to be really careful because there are intestines involved. And then sometimes you can use an ultrasound, but there was no ultrasound, so I did it manually. So I have to put the needle in and then suck it and push the air inside the abdomen and then suck it. It's an interesting thing to do, honestly, and it's nice to not save, but help people get better. It's a a very realizing moment. It makes you feel really good. You can see the liquid. It's not whitish, so that's a good sign. It it shows more that it's a liquid that's not infectious. And later I connect the tube and we collected all of this. That's 11.5 liters. He feels much better now. So now I gotta key in the patient's evolution into the system after I evaluate them every day in the morning. My patient has a hematoma, a subdural, and an epidural. So we can see that it's a epidural because it's between the dura mater and the I've forgotten, between the cranium and the dura mater. So that's how I know it's subdural, and it's epidural because there's an opening here, and it's between the cerebrum. Guys, I'm confused. The cerebral. Oh wait, let's just see this image. Okay, it's between the dura mater and the cranium, so this is subdural, but then there's also an opening between the dura mater and the brain, so this is the subdural, and here we have epidural. He got involved in a road accident. This is where the residents and the medical interns can rest. There are snacks at the back, and there are 2 beds. We put our bags there. So it's during lunchtime, so I'm alone, and I'm looking at my patient's exam. He was involved in an accident. He is a heavy drinker and has been in the hospital for more than a month, and he still has a week and some few days left before he can go home. We have maintained him here because he's on antibiotics for 4 weeks, but there's like 2 weeks remaining. Let's go grab lunch at the restaurant area. Everything is free, so let me show you how it looks like. I totally forgot to show you my food. I totally forgot to. But on my next vlog, I will show you. I honestly forgot. Just left the hospital. This is the hospital, this behind me. So we're going to catch a van and go home. I left, it's exactly 4:35 or something. We were done by 4, but I wanted to stay a little longer because I was nervous to ask to leave, which I shouldn't be because I've done all my daily obligations. I am studying for my USMLE exam, so I'm using this platform called RD Medicine for my revision. It's 10:43 p.m. so it's pretty late. I want to sleep at 12. So I'm done. I'm doing my hair. I'm gonna comb it into an afro and then head to sleep. It's 23:15 because tomorrow I gotta wake up early at 5:45. So I'm about to go sleep right now. putting my, how is it called? I forgot the name. So that I can sleep and my hair doesn't get all undone in the morning. Good night, guys. That's it for today, guys. Thank you for watching. Remember to subscribe, like, and share. Bye-bye.